My name is Mary Sheppard. I'm a cardiac pathologist here at the Royal Brompton and Harefield Hospital Trust, and my job here within the pathology department is looking at cardiac specimens, and the majority of my work actually is looking and examining the hearts of young people who tragically have died, and that is where families first come into contact with me when they realise that the heart of their loved one is actually being sent from where the initial autopsy took place with the local coroner. The heart is actually sent to me here centrally within London, and I examine the heart to give a cause of death, because as we're aware, the majority of the causes of sudden death are cardiac. Pathology is really the study of disease. All disease that affects the body affects it in different ways. And as pathologists, we examine the body at autopsy to see what has caused the death. When a sudden death occurs, as families become aware of, the actual investigation of that death, obviously when there's been no illness prior, when it's a true sudden death, the family are devastated, but it's the local coroner is responsible for the investigation of that sudden death. So the local coroner in the area will ask a pathologist, generally from one of the local hospitals, because every hospital throughout the country has pathologists within it, and that pathologist will carry out the autopsy. They will actually examine the body to find the cause of death. And when that pathologist discovers a cause of death, obviously that concludes the case. But if he or she doesn't discover a cause at the autopsy, or they think it might be a cardiac cause, that the heart is the problem, then the pathologist will generally phone me up. They are now aware of the service that CRI provides, funded by CRI. Phone me and say, I wish to send the heart to you for specialist examination. I'm an expert cardiac pathologist. I examine hearts in detail, and I'm familiar with a lot of the causes of sudden death that pathologists may not be familiar with. There's many causes requiring both examination of the heart by naked eye and microscopy, actually under a microscope, which is a very important instrument I use on a daily basis, because the heart can look normal, but it may not be normal, and one needs to look down a microscope to see it, to find the abnormalities within the heart. In 99 out of 100 cases, when the pathologist doesn't find the cause at autopsy, the cause is cardiac. Pathologist examines the whole body, because there may be other causes outside the heart that can cause sudden death, like a brain hemorrhage. Very important to examine other organs, which the pathologist does in detail. Once they eliminate those causes, they then concentrate on the heart. But pathologists out in the community are out generally throughout the country, very busy people. Autopsy is only a very small part of their everyday work. They often have to go back to their hospital to resume their work. And giving the time to examine the heart in detail is something that they really prefer, that it's sent to an expert like me to do it. They prefer that option than doing it themselves, because they feel their expertise is not on the standard to give it a thorough investigation. Obviously, when a death occurs, the family are devastated, and they will often be anxious to make the arrangements for the funeral, depending on the wishes of the family and their religious beliefs. So we're very aware of that people may want to have burials quite quickly after death, or want to arrange them urgently. So we will have the heart sent to us by courier and returned by courier to the referring pathologist. We will discuss with the coroner and the coroner's officers who work as to the timing of the burial, and we will do our best to return the heart within that time frame, so that the family can go ahead with their arrangements, knowing that the heart can be returned for burial with the deceased. At the initial autopsy is done quickly, because they need blood samples that need to be taken if they're investigating for drugs or for any type of toxicity then it's important to do the autopsy quickly so that the blood can be examined straight away. But as regards the heart, we can actually fix the heart, which is what we do, so the heart does not deteriorate. It's fixed in a particular solution and then sent to me once it's fixed. So we can examine the heart even several months after death if the heart is preserved, which is what we tell pathologists: please keep the heart for examination. We require the whole heart in these situations because the heart may look normal, yet when we look down a microscope at very small parts of it, there may be abnormalities. So we have to sample extensively all the chambers. There's 4 chambers in the heart. So we need to look carefully at all those chambers. We also need to look carefully at the electrical conduction tissue, the electrical activity of the heart. So that requires us to have a detailed examination of the whole heart as intact as possible. Now, pathologists sometimes will look at the heart initially and look at it, what we call it, macroscopically, but they will often leave the whole heart to be examined by us. So we ask them to keep it as intact as possible so we can look and examine every part of it. It is very important to make a precise diagnosis of what the cardiac disease was that caused the sudden death. And in 80 to 90% of our cases, those cardiac diseases are genetic. So it is very important to make the right diagnosis, particularly what we call for the cardiomyopathies and the channelopathies, which I'm sure you're aware of are the most common causes of sudden death. These are familial, and the cardiologist who's screening the family will want to know precisely what was the cause. Was it arrhythmogenic right ventricular cardiomyopathy? Was it dilated? Was it hypertrophic cardiomyopathy? All these have different investigations done when the family are being screened. So once the cardiologist is aware of the right diagnosis, he can go down one particular pathway with the family, making it efficient and precise for them to be examined, shortening the length of investigation for them. Arrhythmogenic right ventricular cardiomyopathy is a very difficult disease to diagnose. The heart may look absolutely normal, and it's the examination at the microscopic level that gives the diagnosis. And you need to sample extensively, in other words, take lots of pieces of tissue, and you need to look at it very carefully to make the correct diagnosis. Obviously, if a family have discovered after the trauma of the sudden death and then the diagnosis is made by me, the family may have lots of questions about this particular disease. But really they need to go to a cardiologist who will screen them and answer their questions about the incidence, the risk factors, what type of lifestyle altering behaviour they'll have to do to prevent further deaths. So they will go often to the cardiologist to get that advice. I will give them advice about the diagnosis itself and what the significance of that. But it's really multidisciplinary. It's between the cardiologist, the pathologist like me, and the general practitioner also needs to be aware so that the families can go to their general practitioners and interact with them. This is very important because the coroner tells the family that he is sending the heart to me for specialist investigation. The coroner can do this if he decides it, but he tells the family that the heart is being sent to me. Once that occurs, I then get consent from the family if I wish to retain the heart, if it's a particularly unusual or very rare cause of death, and also the blocks. When I take the little pieces of tissue that I look under the microscope, I retain those for future research. I have a large database, and this database enables me to carry out lots of research projects on the different causes of sudden death. By doing these projects, we hope to find out the causes and prevent them. Without research, we can't really determine the causes. It is very important they are informed promptly after the sudden death of a diagnosis of a cardiac disease, because as we're aware, the majority are inherited. within families. So other members of the family are at risk of sudden death. So it's vital that the rapidity of diagnosis, the family can go for screening straight away. You could well imagine the anxiety and stress that they are under, first of all with the sudden death, and then realizing other family members are at risk. So the urgency of a proper diagnosis and urgent rapid screening is vital, I think, for that family.